Exercise after lower back surgery is very individualized depending on the type of surgery you have and the muscle deficits that you have. So we're really not going to focus on exercise today. What we're going to focus on is the proper way to get in and out of bed and go from sit to stand, because actually it's harder to get out of bed than it is to walk. We want to think of your back as a log between your hips and your shoulders. You know, a log does not bend, a log does not twist. You want to tighten your tummy muscles, keep that core as stable as possible, and use your arms and legs to do the activity. In the hospital, the head of the beds do elevate, making it a little bit easier to get out of bed, but at home you don't have that opportunity, so it's best to practice with the bed flat while you're in the hospital so you'll be comfortable when you go home. Now, in order to get out of bed, you bend the opposite leg up. You want to take that arm across, push with your leg, and keep that spine straight. Once you get into this position, take your legs off the side of the bed and push with your elbow and your hand to come straight up. Now, scoot forward to the edge of the chair or bed so that your feet are on the floor. Again, keep your back tight. Keep the tummy muscles tight so that you don't bend and twist in the back, you bend at the hips. You want head over toes, lean forward, and come up. When you sit down, it's just the opposite, except make sure that you step back so you feel whatever surface you're sitting on the back of your legs. Now bend in the hips and knees and sit down. And that should help to protect your lower back when you go from that sit to stand position. That's used to get on and off the toilet, on and off a chair, or in and out of a car.
Hello, I'm Alyssa, an occupational therapist here at University Hospital. After spinal surgery, your doctor may recommend limitations in bending forward. I'm going to show you 3 pieces of adaptive equipment to help you maintain your independence in activities of daily living. The first one is an easy reacher. This will help you pick up things from the floor. Great, Brian. Second piece of equipment is called a long handle bath sponge, and the handle is flexible so that you can bend it, and you can also keep it straight, and you can reach down, wash your legs, bend it, and wash your back. And reach also your feet. Perfect. And this is called a stocking aid. And what you'll do is you'll have a sock. The back of the sock goes on the back of the gadget. Great. And you'll keep a seam straight on the gadget. And at the little knots, you'll bring the sock up to the little knots on the gadget. The item will drop down on the floor, and you'll put your foot in the gadget and pull up. For your convenience, University Hospital has partnered with Integrity Medical, located at 10th and Walton Way. And this is Brian Byler, who will work with you to purchase any equipment that you may need.